Here's some quick simple tests that you can do on your own shoulder to figure out what's causing your shoulder pain. If your shoulder hurts when you lift your arm and you can't lift it far, or put it behind your back, and turning your arm down from this position is a lot more restricted than your good arm, we suspect frozen shoulder. But the real test is lifting your arm. If you can't lift your arm all the way up, even when you use the other arm to help, it's very likely that this is your problem, so don't test any further because every test will be positive. If your pain is in a very specific location, right on top of your shoulder, especially with your arm in the highest position, or right across your body, or it's tended just to press, this indicates that you have an inflamed AC joint. I'll leave a link below to a video on how to fix AC joint issues. To test your shoulder for a labral tear or slap lesion, put your arm out in front of you and in, turn your thumb down and resist downward pressure. If this causes pain deep in your shoulder or at the back, but it's noticeably less painful if you resist with your palm up, it's likely that you've damaged the cartilage surrounding your shoulder socket. Biceps tendinopathy is painful and often tended to press right in the little groove in the front of your deltoid. It can sometimes refer pain further down over your actual biceps muscle. The best way to confirm biceps tendinopathy is with the uppercut test, which is positive if you get pain at the front of your shoulder with a sudden uppercut movement up and across your body against resistance from your other hand. I'll leave a link below to a video on fixing biceps tendinopathy. Shoulder impingement occurs when structures like the biceps tendon, shoulder bursa, or the supraspinatus tendon get compressed between the arm bone and the top of the shoulder joint when you lift your arm. If you turn your arm thumb down in front of you, relax your arm and keep it relaxed as you push it to the vertical position using the other arm, this reduces space within the shoulder socket. If it hurts, that's a positive test for impingement. Now, the four muscles that hold the head of your arm bone down within the shoulder socket to reduce impingement are the rotator cuff muscles. They can get strained, inflamed, or torn. The rotator cuff muscles can hurt in various places, but they often cause a pain that's deep in the shoulder or referred to the outer arm. It can feel like it's coming from your outer deltoid muscle. If strained or damaged, it can hurt raising or lowering your arm or putting on a jacket. The first way to test these muscles is using Job's or the empty can test. With your arm 90 degrees out from your body, 30 degrees forward and thumb down, resist downward pressure. If that's weak or reproduces your pain, your supraspinatus, or in fact any of the rotator cuff muscles, are likely involved. To isolate the issue more to your subscapularis muscle, put the hand of your sore shoulder on your opposite shoulder, lift your elbow, and then resist as your other hand tries to pry it off your shoulder. It will be weak or painful to do if you have tendinopathy or a tear in your subscapularis. Or you'll feel pain or weakness pushing up against a wall behind you. If your infraspinatus is involved, when your elbow is against your body and your arm is turned out, it'll be hard or painful to resist inward pressure. And the way to isolate your teres minor more is to put your arm out 30 degrees forward and hand up, and then resist forward pressure from your other hand. And finally, if you're over 60 and you've just been getting a gradual increase of general shoulder pain, especially if you get shoulder noises with movement, then it's likely that you have osteoarthritis of your shoulder. Now, most shoulder issues come from a combination of three things: a lack of upward rotation of your shoulder blade, too much forward tilt of your shoulder blade, and rotator cuff muscle weakness. You can correct all three with 3 simple exercises, so I'll leave a link below to a video on how to do that.